The topic today is family caregiving. We're really pleased to have with us our Executive Council member, Martha Willits, who's going to kick things off, and I thank you all for joining us.
Thank you, Anthony. Good morning, everyone. As a member of Iowa's statewide volunteer network, and I'm joined by several partners here today, I'm delighted and pleased to be here to hold up and elevate the concept and reality of family caregiving, which plays such a vital role in our healthcare system in this state. In Iowa, and in fact in a number of states across the country, AARP is fighting to help more than 42 million family caregivers in America. But in Iowa, that number is equally significant, 540,000 family caregivers. I'm going to repeat that because it's really been on my mind this weekend. 540,000 Iowa families are caregivers who make it possible for older Americans to live independently at home. And I think all of us have been caregivers. If you're an AARP supporter, as we all are, then you're age 50 and above. We've been called the sandwich generation forever, but in fact, in our time, sandwich generation takes on quite a new concept because we're living longer and more ably. Our parents are living longer, more ably. Our children are very busy with careers in this economy, and they have children, and sometimes they have children. So I call it a triple-decker sandwich. We're often caught in between doing a caregiving in all ways. Today we're talking about caregiving in the healthcare arena, an area that is sort of mysterious to a lot of us, not quite like babysitting grandchildren, which I enjoy. So that's why I'm pleased to be part of this statewide effort by AARP to pass a bill to help support Iowa families in this caregiving role. And it's a unique role that we play in the healthcare system, bridging the transitions home from hospital healthcare to hopefully independent living in their homes again. It plays a real future in the future health of your family member who's going home from healthcare. Plays a real role in your own health care because it can be an exhausting role. When I retired, fortunately, I was in that kind of position. My mother required a lot more attention from my siblings and I, and we became part-time caregivers with her. And I know as ably as we were able to do it, it was exhausting emotionally, exhausting physically. It takes its toll even financially on those doing it. So anything we can do to help Iowa families in this role, I think behooves us all. And the bill we're working on is pretty simply stated, although I can tell you from experience that beyond simple, it has really great dimension. It is called the CARE Act. It has 3 provisions. Again, I mentioned they seem simple on the telling of them. It asks that hospitals join with the patient and designate a family caregiver when they enter the hospital. This is optional, but that's what we ask for in the first instance. In the second instance, then, asks that the healthcare system, in fact, inform that caregiver when the patient is ready to leave, to transition back home. And beyond the informing or the locating of that person, it is then to do some hands-on training to help the person as they go home to be supportive. Remember, it's medical care sometimes, giving medicine, helping with Band-Aids, etc. I did all of this with my mother. It was all new to me. I had no background in medical care, and it was really good to know what to do. I had this kind of service. Many of us do, but if we do, it's just great practice in Iowa. It is not a requirement as yet, and we want to make it a standard and a requirement for everyone to get it, and you'll hear in the survey the kinds of numbers that could include. So, as a former caregiver, and I assume I will be again, I think most of us will do it several times in our lives, and we do it willingly. I know that this is an important concept for everyone to have, and I'm happy to be joining with my colleagues and many others as we talk to legislators and emphasize this role in Iowa.